morning. I'm Carrie Davis at UHS, and we are live this morning at the new physical therapy office in Greene. We're located at the corner of Genesee Street and South Shenango. And with me today is Chuck Burpee, who is a physical therapist and manager of the location. So thank you, Chuck, for having us here today.
Thanks for coming.
Yeah, why don't you tell us a little bit about what you're doing here and how things are going? You opened officially on Monday.
We did. We opened officially on Monday. We saw a need, UHS saw a need to get some satellite locations so that patients that live out in Greene and Oxford and places like that didn't have to travel so far to come to therapy, because the closest would be Shenango Bridge for them, or some people were even driving as far as Vestal. So we really wanted to give them an opportunity to come to a nice clinic and be closer to home.
Yeah, and this is a beautiful facility. If you're familiar with our UHS Orthopedic Center in Vestal, this looks the same, feels the same.
Yeah, it was designed right after Vestal. It has a lot of the same amenities that Vestal has, but it has that smaller hometown feel. It's not as big as Vestal, so people don't feel like they're lost.
Yeah, great. Okay, we're going to go on a tour and show us around here what you're doing here. So come on with us.
So over in this area, we have a couple of workstations that we use for work hardening, conditioning, return to sport, athletics. And typical rehab.
Yeah, and this is Sierra.
Sierra is here to
PTA here with us.
Demonstrate a little bit here for us. So this is what we call a shuttle press, and she's lined up on this shuttle press. It's nice because it doesn't load her body too much. So if somebody is, say, post-op, they don't have to bear their weight through their leg, but we can start to work some of the muscles in the knee and the core. So she's set up here nice and perfect with a nice 90-degree bend, so we're not stressing her knee too much. And then all she's going to do is she's going to push against the board and slide back. And so we're just going to work her legs, get her stronger, work on range of motion. And this also has some attachments for upper body where you can do some Pilates moves as well, and do some higher level strengthening and sport-specific strengthening for things like shot put and throwing, and a lot of good core stabilization exercises.
Okay. All right, great. We're going to move on over here. We'll show you a little bit more of the facility.
So down in here we have our main patient treatment area. We can see we have plenty of tables and for comfortable work. We do a lot of exercises on the tables for stretching and some core strengthening as well. And then we move over into this area and we have some cardiovascular equipment. And we have a variety of cardiovascular equipment to tax the body in many different ways, which is super important when you're trying to return to work or return to sport. Super important to build the strength, the conditioning, the endurance.
Sure.
And then we're gonna.
Equipment here.
And then another nice little exercise that we have here that we use.
Come on over, Sierra. Sierra's going to join us again.
Sierra's going to show us this, how this is. We'll turn you around here, okay?
Now, what's Sierra doing here?
So what we're doing is we're adding an element of strengthening but also balance, which is really key for athletes to return to sport. So she's going to do a squat for us. You can see she's staying up nice and tall, okay? Because athletes don't look down at their feet. They want to look at whatever they're doing, whether it's a baseball coming at them, or if they're looking to shoot a basket, or if they're looking to tackle somebody. So you can see as she squats down, there's a little instability in her legs. She gets to shaking a little bit because it's challenging her legs in a way that's very different than just a typical squat, because she's on an unstable surface.
Okay, great.
And this is super important to get an athlete back onto a field.
Yeah. Great. Thank you, Sierra. This is really great to show our viewers out there what we have. So take us over here into this area and show us. This is great for athletes, you said, over here?
So we have, we started a sports performance. We have the beginnings of sports performance over here. We have some kettlebells for some higher level strengthening. We have medicine balls for, again, that higher level strengthening when we've got an athlete who's getting ready to go back to sport, or even somebody who's going through a work hardening program, and post-op they need to come back and get back to work at a job where they have to do some heavy lifting. And so we also have some heavier weights here. Again, these are not necessarily for people that are just starting out in rehabilitation. This is more for higher level performance is what we're looking at.
Okay, great. And we have the facility up here as well?
We do. So the facility extends up here. We have some more cardiovascular equipment. This one is an upper body ergometer, which is designed to condition and strengthen the upper body, like a bicycle, but for the upper body. And then we have an elliptical trainer as well.
Okay.
And then over here against the wall, we have two private treatment rooms where we do evaluations,
Yeah.
or if there's somebody who's got some sensitivity and can't be out in the open treatment area, they can be in more of a private setting.
Okay, great.
And then in this room, we also do have traction. So more commonly referred to these days as spinal decompression.
Okay.
In this room, we can do lumbar traction, cervical traction,
Yeah.
for people who are having difficulties with spine.
Okay, so this is more of a private area where people could come in and do things outside of the normal area. the
Yes,
common
absolutely,
area out
yeah,
here.
absolutely. If somebody's, is not comfortable being out among a lot of people, then we
Right.
can give them a private
Okay,
space to be treated.
great. Now, we talked a little bit about, obviously, people come for physical therapy, people that need to return to work, people that need to get better after surgeries, but you've got a lot going on here for athletes as well, and plans
do.
for future programs.
We
So-
do. We feel like up in this area, there's a real need for athletes to have a place to go for performance,
Yeah.
and not just rehab.
Uh-huh.
And so, you've got a lot of athletes that they do conditioning in the off season to prepare for this season, so
Yeah.
that they're at their peak when their season starts. Our goal is to set up a performance center here where athletes can come and work with athletic trainers and strength and conditioning coaches,
Great.
and be able to get themselves ready and be prepared for sport. Or if they've unfortunately had a serious surgery, giving them a bridge from therapy to return to sport.
Right.
So they can really do high-level conditioning and training to get
Great.
ready for that.
Okay, great, and more to come on that. So I know
Definitely
that'll
more to
be great
come
for a lot of
in
our
the
local
future.
athletes here. So again, this is the new UHS Physical Therapy location in Greene. It's on the corner of Genesee Street and South Shenango. Now we have more information on about the location on our website at nyuhs.org. And the phone number here is 422-3830. But again, you can go to the UHS website and find more information on that.
Absolutely.
And a lot of people are referred by their providers to come to physical therapy, but if you're interested in coming to the Greene location, make sure you tell your provider about that. So thanks everyone, thanks for joining us today, Chuck.
Thank you. Thanks for
Great.
coming.
Thank you. Thanks everyone.